it's Jessica here. No, I haven't done a video in ages. In fact, I don't know if it's like over a year. Since I've done one for this channel, I've been doing videos for another channel, a collaborative channel. But just a quick update, yeah. Basically, new diagnosis. I still have POTS, but I also have been diagnosed with EDS, Ehlers-Danlos syndrome. Basically, it's like a disorder of the collagen in the tissue. I don't want to go too much into the technical side because it's way above my head, but basically it causes like unstable joints, like the type that they think I haven't had. I've had the clinical diagnosis, and I'm going to see a geneticist at a research facility to get genetic testing to establish exactly which type, but they're pretty sure I have type 3, which is mobility, but it might be classical type, they're not sure. But some of my main symptoms are frequent desiccations, and obviously all the stomach problems I was having were related to the EDS, because quite a lot of times you have gastro complications. Motility issues, which is like from when the food goes through your body till it comes out of your body, that sort of problem. I have frequent desiccations, like mainly my right shoulder, nearly every day, pops out. Sometimes quite a few times it just desiccates. Sometimes it just subluxates, and sometimes it comes all the way out. Sometimes my actual shoulder blade, which apparently I have quite uniquely shaped shoulder blades, the muscle and the tissue around the shoulder blade is too elasticy, and it just drops and comes out of place. And also quite frequently now the actual shoulder joint itself here is being coming out, and they are painful. I've had dislocated fingers as well, and they are painful, but just recently I had one of the most painful dislocations, and that is, in fact it was not yesterday but the day before, so that would have been the 21st. I stood up to hug my mum, and obviously I don't stand up a lot. I'm either in bed or I'm in the wheelchair, and then I stood up and to hug my mum, and all of a sudden my knee just buckled and it popped out. It dislocated. It relocated itself, which was good, but it was extremely painful. And I saw a doctor, and it swelled. I didn't see a doctor straight away because I've been told, well, we don't want to be at the hospital all the time because I dislocate something nearly every day now, so we don't want to be at the hospital all the time, so we just kind of iced it and left it, and rested it, and then it just started swelling and swelling and swelling. So and it was just really, really bruised and really swollen. So I went to see a doctor yesterday, and the doctor said, yeah, you definitely dislocated something. Definitely dislocated your kneecap. It's good that it popped back in, but there's obviously damage around the kneecap, and it's got a lot of fluid underneath. She didn't want to send me, because at the moment our local hospital is having an overflow in A&E, and it's only emergencies, like serious emergencies, they're accepting at the moment, and she didn't want to send me to get it drained just yet. She wanted to see if it would go down on its own, if the fluid would kind of go down on its own, and if the swelling would go down on its own. But so hopefully I won't have to go and get a big needle stuck in my knee, but you know, she's put a strapping on it. I've got to be rested for the next week at least, and I'm on pain relief for it, but it's the most painful dislocation I've had yet, I've got to say. I'm in absolute agony. So I guess that's what happens when you have EDS and you want to hug your mum. you dislocate something. It's been really difficult since I had the diagnosis. Actually, it's the most difficult it's been since, like with the POTS, I as for some reason just handled it. It didn't seem life changing, but the EDS, I mean, the POTS was life changing, but I knew that someday it might go away. But the EDS, it sticks with you for the rest of your life. You know, it's a genetic issue, and quite often with EDS, you actually get POTS. They're kind of interlinked conditions, but the EDS sticks with you for life. Well, that's what I've been told, anyways. And I'm waiting. I haven't, obviously, because I got diagnosed by a rheumatologist. I didn't get diagnosed by a specialist. They're sending me to a specialist, but I've seen quite a few people now, and they've all agreed. We're quite angry because we mentioned EDS before to a paediatrician, who obviously wouldn't know what it was, but she didn't even look into it or anything. But it was the physio who actually spotted it and said, you know, we need to send you a rheumatologist. And the rheumatologist has said, yes, you've definitely got it. I've scored 9 out of 9 on the scale. Yeah, we've spoken to the geneticist, and he's pretty sure as well, though, over the phone. And obviously with the frequent dislocations, the thing they want to do is just get me there as soon as possible so we can get it officially diagnosed and we can try and find the right sort of, like, I'm not sure if there's exactly a treatment, it's just a lot of managing, but there is, like, you know, I'm going to have to be strapped up quite a lot, and so I need to be taught how to strap properly, and, you know, how to get the right equipment and stuff like that. And they'll probably send me, there's 2 leading specialists, and there's only 2 I think in the UK. One's in Sheffield, but that's that's like a paediatrics one, and there's one in London, so I'll probably get sent to London for the clinic. But because they're specialists and it's a really, really rare condition, we are actually called zebras because it's that way. But yeah, just a quick update. Well, it's not really quick, it's 7 minutes, but just an update on that and on EDS. If you have any questions about EDS, if you want me to do a video on the symptoms of EDS, if you want me to, you know, if you want to ask anything, if you think you have this, or just put a comment below, or, you know, and I'm going to start doing videos more frequently on this channel again because I feel like I want to start doing them more, and since I'm not getting the 6th form as much, I thought I'd do more videos, and especially since it's like 2 days before Christmas, I know, but yeah, I'll start doing more videos, and I'll explain more about, like, the personal side of things, like how I've been struggling at 6th form and stuff in my next video. So yeah, moral of the story is, if you have EDS, do not stand up to hug your mum. I was standing up to hug my mum because she did something nice for me, and I was saying thank you, and you end up with a bandage on your knee. You end up with a dislocated knee. So, moral of the story. So yeah, bye guys.